Okay, starting off with question 1. While doing your rounds, you walk into a resident's room to check the resident's urine output bag, but there are no signs of urine in it. What should you do? A. Ask the nurse. B. Check for kinks. C. Ask the resident to pee first. And D. Inspect if the catheter is dislodged or not connected properly. You have 30 seconds and the time starts now. So the correct answer in this case would be B, because if you check the resident's urine output bag and you don't see anything in it, the first suspicion should be that there are kinks, and if there are no issues and the resident is uncomfortable, then you have to notify the nurse so they can assess for potential medical issues. And asking the resident to pee in this situation is not appropriate because the catheters are automatically draining the urine from the bladder. Alright, question number 2. A resident just finished drinking a cold liquid and the nurse ordered for their oral temperature to be taken. How long should you wait till you take the temperature? A. Take it immediately since it's urgent. B. Wait at least 5 minutes. C. Wait at least 20 minutes. Or D. Wait at least 30 minutes. If you chose C, then you are correct. After drinking a cold liquid, the temperature inside the mouth is lowered and it can result into an inaccurate reading if it's taken too soon. So you should wait at least 15 to 20 minutes after the resident has consumed anything too hot or cold. Question number 3. You were assigned a resident and upon arrival to their room, they said they didn't want a bath. According to the resident's Bill of Rights, they have the right to A. Refuse care. B. Be forced to bathe for hygiene reasons. C. Be reported for non-compliance. And D. Be only given sponge baths instead. The correct answer in this case would be A, because according to the Residents' Bill of Rights, they have the right to refuse care, and as long as they're mentally competent to make that decision. This falls under the right to dignity, autonomy, and participation in their own care decisions, and you should respect their choice. Also, don't forget to report the refusal to the nurse and document everything. Question number 4. A new resident just arrived at the facility. According to the Residents' Bill of Rights, which of these things are they allowed to do? A. Smoke in the facility. B. Keep and use personal belongings. C. Know the history of every patient in the facility. D. Be left alone without supervision at all times. If you chose B, then you are correct. According to the Resident Bill of Rights, they have the right to keep and use personal belongings if they help them feel more at home and maintain a sense of independence. However, they don't have the right to smoke anywhere in the facility, and smoking is restricted to designated areas for safety and health concerns. They're not entirely entitled to know everyone's medical history according to HIPAA, so be mindful of that. They also cannot be left alone without supervision, especially if they require assistance for activities of daily living and other things too. Question number 5. To protect a patient's skin when moving them up in bed, you should A. Pull them up quickly by their arms. B. Use a draw sheet or friction-reducing device. C. Drag them by their gown or clothing. D. Lift them without help to save time. If you pick B, then you are correct. You have to use a draw sheet to prevent shearing of the patient's skin. And this is a major cause of breakdown and pressure injuries. So you shouldn't pull the patient by the arms because you can cause joint strain or you could break a fragile skin. And last but not the least, question number 6. A resident has refused to eat since breakfast and is now refusing lunch. What should the CNA do? A. Force the resident to eat for their health. B. Ignore the situation and check back at dinner. C. Report refusal to the nurse and document it. D. Remove the food and tell the resident that they missed their chance. Alrighty, if you chose C, then you are correct. If a resident refuses to eat, especially for multiple meals, you should never force them or ignore the situation. Instead, report to the nurse and document that the resident refused to eat. Ignoring the situation might be inconsiderate because the resident might have an underlying medical or psychological issue that requires professional attention. However, do try to make the food sound more pleasant to the resident and try to convince them to eat, but do not force them. If they still refuse, then report it to the nurse, and the nurse might be able to find out another way to get this resident to eat or find another solution to the problem. With that being said, guys, this is the end of the video. Here are some things to remember. You should respect the residents' rights. They do have rights to refuse food or any care as long as they're competent to. And even if they're not, there are also some rules in place. And you should never force a resident to do something that they don't want to. And don't scold them. It's a violation of their rights and is also considered abuse. Always observe and report behavior and conditions to the nurse and document accurately, record their meals, the intakes, and everything else. Well, I hope you enjoyed this video. Please do not forget to like and subscribe, and I'll see you in the next one. Thank you.